Hello, welcome all to our channel Toxicology on board. Today we'll discuss in this video about question number 19, radiation toxicology, linear energy transfer. You have to understand in case of DABT exam, few questions on radiation toxicology also you will come across. Even though today radiation might not be a well discussed topic, but when you look at during World War 1940 or 1950, there were a lot of hazards, toxicological hazards have happened because of this radiation exposure. So there is a possibility that this our examiners there might be a one of the favorite topic might be from radiation toxicology. So few questions you might come across radiation toxicology in your exam. So through this video, we'll discuss about linear energy transfer (LET) that we'll discuss. So this question is taken from a DABT recertification question. So the question is, after an accident, it's a case study actually. A worker was determined to have between 400 to 500 gray of low energy transfer radiation. So the worker, option A, will die within 48 hours of CNS syndrome. Option B, will die in less than 1 week from GI tract syndrome. Option C, may die from hematopoietic syndrome in 5 to 8 weeks without intensive medical support. Option D, will suffer from nausea and vomiting for several weeks but then should recover. Option E, will experience no significant symptom from the exposure. So the question is, there is a worker is working in maybe in a factory where he is dealing with radioactive materials. There was an accident and he was exposed to 400 or 500 gray low energy radiation. So what will happen to him? That is the question. The right answer is option C, may die from hematopoietic syndrome in 5 to 8 weeks without intensive medical support. So whenever there is this radiation type of exposure, there are three different systems which are getting affected. One is CNS syndrome, one is GI tract syndrome, another is hematopoietic syndrome. Today we are discussing in this video only about hematopoietic syndrome because the length of the video will increase. You go back and read about CNS and GI tract syndrome. If in future I will come across one another video we're discussing about these syndromes. So all these three types of syndromes, no, they are affected at different doses of this radiation. So we'll discuss in this video what is LET and what are the various doses or the units of measurement for this radiation. So as you have seen in the question, low LET is there. Similarly, there will be high LET is also there. Whenever there is high LET, this is a typical cell. It will affect the DNA at a single site. Whereas in terms of low LET, multiple targets will be there in the case of DNA mixed with which contains both. I think low LET as well as high LET. So before entering into theoretically entering into, let's understand through this diagram, simple diagram. So whenever there is high LET, as you can see here, there is single location, a single site of action in the DNA. So cluster DNA injury takes place. And if you see in the case of low energy low energy LET, you will see that multiple targets are there within the DNA, which is causing broken DNA. Okay. So these are the taken from Clayson as well as Hayes. So there are below I have given even the chapter name as well as page numbers. I would request you go back and read. In this slide, we will only discuss about this. This table is directly taken from the Clayson. We'll discuss about the units of radiation and radioactivity. We'll compare it with the older units. So basically, in this table, they are discussing about three units. One is becquerel, one is gray, another third is sievert. Becquerel, no, he was a scientist of Madame Curie only. So we'll see what is the description. Radioactivity, the spontaneous decay of the atomic nuclei. One Curie is equal to 3.7 into 10 to the power of 10 becquerel. One becquerel is equal to number of disintegrations in 1 second. Coming to gray is the dose which is used in the case of measuring in the case of tissue. One gray is energy uptake of 1 joule per kg. Rad, if you see one radiation RAD, originally radiation absorbed dose is equal to 10 milli gray. And coming to sievert, I think this is a German name. Effective dose P allows conversion of dose from gamma, beta and alpha radiation to a standard unit. Dose normalized to effect of gamma radiation by applying WR based on the Another thing you will come across this concept, relative biological effectiveness, RB. Whenever you are reading about radiation toxicology, you'll come across this terminology also of the radiation of interest to the absorbed dose in an organ or tissue to derive the equivalent dose. The effective dose is usually expressed as millisievert MSV, and MSV is equal to 10 to the power of minus 3 SV. Okay, REM is the original based on Ronton equivalent man. So this is also another one radiation unit. I know it's quite confusing because all these types of units are there. But I'm saying you this question, whatever I'm discussing, it is from recertification question only. Maybe in current trend they might not ask on such topic, but um, earlier they used to ask, as I said. So let's understand what is LET very quickly. We'll go through. The rate of energy dissipation by a single event is referred to as linear energy transfer. Okay, energy dissipation by single event, single exposure. The LET of a charged particle is the average energy lost due to interactions per unit length of its trajectory, given as kilo electron volts per micrometer. That is the reason first slide I have shown you some pictorial how it is affecting average lost. Next, X-rays, gamma rays, and beta particles. In the table also you have come across this one. Similar energies produce sparse ionization tracks and are classified as low LET. So you might get one question: name the which of the following radiation are low LET radiation. Option A, like this you might get. So you should be able to remember this one. Okay, LET depends on the energy of the particle. For example, the LET of 5 milli electron volts, mega electron volts, whatever it is, alpha particle would be 100 kilo electron volt per micrometer. Neutrons released during the nuclear chain reactions have a greater range and lower LET, 20 per a 2.5 mega electron volt neutron. A 250 kilo electron volt X-ray has an LET of 2 to 3 and a cobalt 60 gamma ray zero point 0.2 to zero point 0.3. A beta particle is a simple electron that is released from the nucleus when neutron converts into a proton, and it has a similar low LET values depending again on its energy. Again, I know it's difficult for you to remember it, but remember X-ray, gamma ray, beta particles are LET. Or how you are defining whether a particular radiation is low or high LET based on these numbers. Okay, for this reason, I would request you to pause the video, read it. I have given the references also. Better you go back and read in detail. Okay. The relative effectiveness of different types of radiation in producing biological change depends on the deposition of energy, that is LET. Okay. Let's again coming back to the radiation doses. The basic unit of radiation activity is a becquerel, which is a nuclear disintegration per second. It was same given in the table. The older unit of activity is Curie, which is named after the scientist Madame Curie, which corresponds to the number of disintegrations in 1 second for 1 gram of radium 226, or 1 Curie is equal to 3.7 into 10 to the power of 10 decay per second. Table also you can see. Second slide it was. Thus 1 becquerel is equal to 2.7 into 10 to the power of minus 11 Curie. The EPA continues to use old unit of activity with regard to radon. For example, the EPA level of concern for radon in the home currently is 4 picocurie per liter, which is equal to 148 becquerel per meter cube. The basic unit of dose is Gray, which is the amount of energy released in a given mass of tissue. 1 Gray is defined as 1 joule of energy released in 1 kg of tissue. The older dose unit of radiation is 100 ERG per G is 1 by 100 of Gray. The other common measures is the Severate, which is the dose equal, that is the dose which can be calculated, and appropriate quality factor. So we will basically discuss about acute radiation syndrome, because we will discussing about our options are about hematopoietic, because option C was hematopoietic syndrome. The hematopoietic form of acute radiation syndrome IARS, when human receive whole body doses of ionizing radiation from 2.5 to 5 Gray, 250 to 500 rads. The hematopoietic system manufactures the corpuscular elements of the blood, which are nothing but RBC, WBC, and leukocytes, against lymphocytes, and is the most radiosensitive vital organ in human. Radiation exposure causes the number of red cells, white cells, as well as platelets in circulating blood to decrease. As a result, what is happening? Those levels that cause this syndrome also may damage cells in other organs like kidney, liver, also causing the affected organ or organ system to fail. Because to these other organs, the number of these RBC, WBC cells are reaching is less. The patient initially experiences mild symptoms of prodromal syndrome. I would request you to go back and read about prodromal syndrome, which appears in a matter of few hours and may persist for several days. Okay. Next, for example, radiation doses ranging from 2.5 to 5 gray. This is 250 to 500 rats. This is type O produces a decrease in the number of bone marrow stem cells. When the cells of the lymphatic system are damaged, the body loses some of its ability to combat infection. Because number of particles also decreases with loss of bone marrow function, the body loses its amount of its blood clotting ability. This makes body more susceptible to hemorrhage. So, for persons affected with hematopoietic syndrome, the survival time shortens and the radiation as the radiation dose increases. So, radiation dose increases, more toxicity is there. When death occurs, it is a consequence of bone marrow destruction. Okay, death may occur 6 to 8 weeks after irradiation in some sensitive human subjects who receive a whole body dose exceeding 200 rads. As whole body dose increases from 2.5 to 5, that is nothing but 250 to 500, irradiated individuals die sooner. If the radiation exposure is not lethal, 100 to 200 rads, bone marrow cells will eventually repopulate, okay, to a level adequate to support life in most individuals. As you see that our body also has some defense mechanisms. So if the exposure, radiation exposure is less, there is a possibility that our hematopoietic system can repopulate them. So that such kind of patients will be recovered 3 weeks to 6 months after irradiation. The actual dose of radiation received and the irradiated person's general state of health at the time of radiation determine the possibility of the recovery. Again, similarly, like a typical chemical exposure, you can see that the toxicity depends upon the radiation dose as well as the time of exposure also. Right? The severe reduction of blood cell causes anemia and permits exposed individual to become susceptible to infection. This results in the death of the those individuals. So not only because of the radiation, after the exposure to radiation, because of the infections also, that particular individual might die. Survival probability of patients with hematopoietic syndrome is enhanced by intensive support care. So one of the options you had about the supportive care also and special hematological procedures. So through this video, you were able to learn about hematopoietic syndrome, LET, high LET, low LET, various radiation doses you were able to learn. Okay, so in future we will see that we will be discussing about other GI as well as CNS syndrome also. We'll try to come up with some video. So for this video, thank you so much. Be curious. For any questions, please comment and please write mail to arya.priyanka18@gmail.com for any queries. Like, subscribe and follow my YouTube channel Toxicology on Board. I know this video was a bit difficult to understand and remember all the radiation doses. For this thing, what you do is that pause the video, go back to the pages which I have mentioned, so that you will be able to remember them. Because what is the ultimate goal of uh, our thing is that reading is not just enough, remembering is important. Because at the time of exam, you will not have enough time, because you have 200 questions and you have, I think, 4 hours or 4.5 hours will be there. Each question, when you have, because when you are giving this exam, it is a digital exam, one of the questions will also go to the next page. You might not have enough time to spend on each question, so better to know all the answers before only. By just looking at the options, you should be able to understand. You cannot spend too much time on a single question. So anyways, all the best for the exam. Thank you.